Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with another new topic, that is Puerperal Sepsis and Puerperal Pyrexia. First, we'll see Puerperal Sepsis. What is Puerperal Sepsis? Here, Puerperal sepsis is a bacterial infection of the reproductive organs occurring within first 6 weeks after childbirth, abortion, leading to fever, that is only puerperal pyrexia, and other signs of infection. Here we can see also known as postpartum infection or sepsis. Here puerperal sepsis, it is one of the bacterial infection, and then it is going to occur to the reproductive organs. Reproductive organs, that is within the time period, that is first 6 weeks after childbirth, it may be abortion or leading to fever, that is only puerperal pyrexia. It is also known as postpartum sepsis or postpartum infection. Okay, next we'll see the pyrexia. What is pyrexia? Here, fever. That is, it is defined as a temperature more than or equal to 38 degrees Celsius. That's 100.4 degree Fahrenheit on on two occasions, that is 24 hours apart within the first 6 weeks of postpartum, that is excluding the first 24 hours. Here temperature will be greater than or equal to, more than or equal to 38 degrees Celsius, that is 100.4 degree Fahrenheit on the two occasions. Here what they are doing in the sense excluding the first 24 hours, and then just after delivery first 24 hours considered normal because temperature increased due to effect of dehydration following delivery. Here temperature increased due to the effect of dehydration, that is following the delivery. Due to delivery there may be the dehydration, that's what there will be the increased in temperature. That's what it is considered as normal, that is first 24 hours after childbirth or abortion. And next, causes. Here we can see the cause. First one is puerperal sepsis. It's a most common cause. And then endometritis. Here inflammation of the endometrium layer, that is most common site here. And then retained products of conception. Conception is nothing but a fertilization. And then wound infection. That is, it may be episiotomy or C-section. And then urinary tract infection, that is UTI, and then mastitis and breast abscess. Here inflammation of breast, mastitis and breast abscess. Here we can see most common causative organism is group A streptococcus, and then most common mode of spread is cervix and vagina. Through that one only that infection is going to spread, that through the cervix and vagina. We'll see the risk factors now. Here, prolonged labor, that is more than expected, and then prolonged rupture of membrane, and then multiple vaginal examinations, and then retained placenta. Next one is operative deliveries, that is only C-section or forceps delivery, and then poor hygiene or aseptic technique. And next one, last one is anemia or immunocompromised state, that is having low immune power, low immunity. These are the risk factors of puerperal sepsis pyrexia. Here we can see that prolonged labor it is. And then retained placenta. Here some placenta is going to remain, that some part. We'll see the clinical features now. That is fever more than or equal to 38 degrees Celsius, and then all inflammatory markers increased, and subinvolution of uterus. Here subinvolution of uterus is nothing but a failure of the uterus to return its normal shape and size after childbirth, that is subinvolution of uterus. And then uterine tenderness, that is pain or discomfort. and then foul smelling lochia, and then lower abdominal pain, and then tachycardia, abnormally rapid breathing, malaise, that is physical discomfort. These are the clinical features. Next one, see the investigations. Here, investigations. First one is history collection, thorough history collection, and then physical examination is a must. After that, complete blood count, CBC, and then C reactive protein, and then ESR, erythrosedimentation rate, and then blood cultures, high vaginal swab for culture and sensitivity test, and then urine analysis and culture, and also USG, that ultrasound, to check for retained products or abscess. These are the investigations. Next, we'll see the important part of this, that is management. First one is a general. Here in general, that hospitalization is needed if severe, hospitalization if severe, and then hydration and analgesia can be given, and then has to monitor vitals and lochia, and then second step is antibiotics, broad spectrum of IV antibiotics. Here example given, ampicillin, gentamicin, and then metronidazole can be given, and then adjust, it is based on culture result. And comes to the next one, here specific treatment has to be specific treatment in the abscesses, and then surgical evacuation of retained products if needed. Here surgical evacuation is nothing but emptying, removing, surgical evacuation of retained products if needed. And then next we'll see the complications here. First one is a septic shock. Here septic shock. Septic shock is nothing but it's a life-threatening one, life-threatening condition, and when it happens when blood pressure gradually gradually low level after an infection. Where that it's a threatening, life-threatening condition where the blood pressure is going to drop suddenly after infection. That is nothing but a septic shock, we can say. And then second one is a infertility due to pelvic inflammatory disease. And then after that, peritonitis. Here inflammation of the peritoneum, we can say. And then death if untreated or if it's severe. You are very clear with the topic. Please like, share, and subscribe to my YouTube channel for more informative content. Thank you for watching.